The World Health Organization has upgraded the public health risk posed by the latest Ebola outbreak in the Democratic Republic of Congo from high to very high at the national level. Health officials say the outbreak, linked to the rare Bundibugyo strain of the virus, continues to spread in eastern Congo, where conflict, displacement and weak infrastructure are complicating containment efforts. According to the WHO, there are now more than 80 confirmed Ebola cases, including several deaths, alongside hundreds of suspected infections and fatalities still under investigation. The Bundibugyo strain currently has no approved vaccine or specific treatment. The United Nations has now allocated up to $60 million in emergency funding to support the response across the region. Officials say the crisis requires more than medical treatment alone, warning that transport, food supplies and humanitarian access are all critical to containing the outbreak.
Containing Ebola requires more than treatment alone. WFP says it requires food, it requires access, it requires transport, and it requires logistics so frontline teams can move fast and affected families can safely follow public health measures.
The outbreak is also beginning to affect daily life and livelihoods in border communities. At the crossing between Democratic Republic of Congo and Rwanda, movement restrictions linked to the outbreak have disrupted trade and left many residents unable to work. For disabled transport workers who rely on cross-border trade to survive, the closure has created growing economic hardship.
Our work is here at the border, and it is this border that sustains the lives of disabled people. When it is closed, we are all stranded. It is this work that sends our children to school, provides us with a home, gives us a livelihood, and even the chance to buy lotion. We shouldn't have to go begging in the streets when life is so hard these days. But as we aren't crossing the border, we're deprived of our earnings from simply transporting goods to the other side. We don't gain much from it.
Residents also warn that many families can no longer access savings held in neighbouring Rwanda as restrictions remain in place. The World Health Organization says the risk of wider regional spread remains high due to population movement and the densely populated nature of the affected areas.